Hi everyone, it's Neil again from singlebestanswer.com. Head over to our website where you can find a question bank dedicated to helping you pass the UK MLA and also the medical school finals. So here's another mini tutorial on a question about collapse. We've got a 46-year-old man with episodes of feeling faint, one episode of loss of consciousness. His wife states he passed out for 30 seconds, twitching all of his limbs 3 times, and he regained consciousness fairly quickly and was orientated to his surroundings. He has type 1 diabetes with retinopathy and early renal disease, and he also has been to see his GP about impotence. So the feeling I'm getting from this question is that he has an episode of collapse with quite a quick recovery time, and the diabetes is relevant here because it's quite significant in that he has retinopathy and renal disease, and he may have other complications relating to diabetes, and that's the biggest clue here as to the cause of his collapse. So impotence, for example, is a result of problems with the autonomic system. And if you have problems with the autonomic system, you can have collapses, poor blood pressure control, orthostatic hypotension. So if I was to do the cover test, which means I don't look at the answers, but try and answer the question outright, I would go for something like an autonomic dysfunction leading to an orthostatic hypotension. And we've got option A as autonomic failure. So we're going to mark that one out, but we're also going to look at the other 4 options to see if there's a better option out there. Option B is hypoglycemia. With type 1 diabetes, you often get episodes of hypoglycemia, of course. Normally, patients with diabetes are sensitive to these episodes. They have hypo-awareness, not all the time. To lose consciousness is quite a significant and severe event. Generally, it wouldn't manifest like this, and it may be related to poor diabetic control. So here, I think this is a less likely option, but one that should be considered, given that there's an episode of sort of complete loss of consciousness with not quite a seizure, but a vasovagal type complication. We're still going to stick with A. What about C, which is a psychogenic loss of consciousness as well? I think this is unlikely here. There's nothing to suggest that there's a psychiatric history, and certainly the symptoms and the witness signs are more in keeping with an organic cause, really. D is silent myocardial infarction. As you know, patients with diabetes can get a silent MI. They generally wouldn't feel any symptoms. They may feel slightly unwell afterwards, but it's the complications that they go and see their doctors about. So shortness of breath, reduced exercise tolerance, fatigue, that sort of thing. Okay. And what about E, tonic-clonic seizures? Well, the distractor there is that the patient collapsed, lost consciousness, and had jerking of all 4 limbs, albeit briefly. Now, patients with a true tonic-clonic seizure tend to have a more protracted seizure, lasting a bit longer than that. Also, the big clue is when they come round, they are not orientated straight away. They take some time to come round. They might feel a bit drowsy and groggy and feel unwell for some time afterwards. So we're going to go for option A, which is our initial thought here. That's the right answer. There's a full explanation on our website, singlebestanswer.com. Follow me for more YouTube videos like this. We'll keep posting content, and good luck for your exams.